all of a sudden, out of nowhere, I came down with panic attacks. And it started off with kind of a fear of flying. And then I was in the comfort of my own home and nobody around me. And I had a huge panic attack. In that moment, there was something inside me that was like, we can't do this anymore. And I'm going to spend my life trying to figure out what it is. I was headhunted by the Scottish Rugby team to be their wellbeing coach. A lot of people will say, like, what are the main challenges that athletes go through? And I'm like, it's the same thing as what gets in the way of a cleaner, or a bin man. All the players that I work with, whenever there was a problem on the field, it was ultimately a manifestation of something going on off the field. Your barriers may look like they're related to what's going on. It has nothing to do with those things. The core pillars that I call them, the 4 pillars that somebody needs in order to be well, in order to live that life that they're after. The first one that we all need in order to achieve well-being is number 2. Number 3, the number 4 is...
Dr. Ben Scott was the wellbeing coach for the Scottish national rugby team, and he was hired because of his amazing ability to help people overcome their life barriers, which for the rugby players were presenting as sporting barriers, as performance issues, which is exactly what we unpacked in this episode. Ben unpacks the link between the physical health and our mental health and how our minds can interfere with our performance. And he goes through how we can overcome this to improve our performance, which then led at the end of this episode to Ben taking me through a practical session, helping me to actually overcome a very specific performance issue that I was having that's every now and again pops up in my practice. This is probably the most vulnerable I've ever been. And so I really hope that it exemplifies everything that we speak about in this episode. Ben has been a massive influence in my life right from the very beginning of my chiropractic journey. So this is actually a very special episode to me personally. If you want to find out any more about Ben, then you can find the links in the description below. Otherwise, let's get right into this episode. I really hope you enjoy this one. Dr. Ben Scott, who are you and what is the mission that you're on?
Well, my name is Ben and I'm a chiropractor, functional neurologist, amongst other things, coach. But ultimately, my mission in life is to help people to live, to fulfill their potential, to be the best that they can be, and to overcome anything that gets in the way of that. So yeah, that's what I spend my life doing.
What is the story behind the person that sits here today? How did you get to that point of doing all that stuff, and why is it that you do what you do today?
Yeah, so like a lot of people in this world, it usually starts when you got your own personal struggles. So my kind of journey into the wellbeing world, health and wellbeing world, started when I was unknowingly when I was 15. When I was at school, I was kind of like a budding professional athlete. So I thought, playing in the professional youth ranks of Scottish football, and confident, great friends, great family, a lot going for me on paper. And all of a sudden, out of nowhere, I came down with panic attacks and fears. And it started off with, kind of a fear of flying. And then I found myself, just like, I just won't go in planes. And then it came about when I was driving to school with my mum. We used to go through the Clyde Tunnel in Glasgow. It's a very short tunnel that I'd gone through thousands of times before. And all of a sudden one day, as we were coming up to it, I just, had this huge panic attack. And I've heard people, describe panic attacks as like palpitations and things like that. It's, if you've had a proper panic attack, it's nothing like that. It's, you all encompassing. You can't move and you think you're going to die. And anyway, got through the other side of the tunnel, and my mum was like, "What's happened there? Are you all right?" And again, 15 years old, no idea what's going on. And again, I just, without knowing what was going on, it was just a case of, right, just keep calm and carry on, and just don't go through the tunnel again. So a bit of a challenge this time, compared to avoiding planes, because the tunnel was the route to school. So at extra cost to my mum, she kindly took me, an extra 20-minute journey to and from school to avoid the tunnel. And again, the more and more I was kind of trying to avoid my fears, the more and more fears came. And so it was a fear of flying, and then a fear of tunnels, and then it became a fear of, pretty much all enclosed spaces. Then a fear of open spaces, a fear of fear itself, a fear of panicking, a fear of being in an environment where someone would say the wrong thing that would make me panic. And, the more and more that this went on, you can't avoid all that stuff. Your life, starts to become very, very narrowed. And of course, I did the typical thing. I went to the GP. My dad's a medical doctor, so I asked him for advice. And again, nobody knew what was going on with me. It was put down to puberty, and he'll probably grow out of it. But as I say, and the other option was, take these pills. If you feel anxious, take these pills, which I at times needed to. So, but again, because my life was becoming more and more narrowed, it's very difficult to avoid all these things. And, growing up in the west coast of Scotland, you're supposed to be hard, and obviously, playing in the sporting field, you're used to trying, give off that persona, but I was really, really struggling, and to the point where I'd have to run out of assembly halls, or not go into them at school, or have to leave classrooms, so eventually the kind of turning point was that tried to avoid all of these, things, and take pills when I needed them. And then I was in the comfort of my own home one night in my own bed, and nobody around me. And I had a huge panic attack. And it was almost in that moment of darkness that a light kind of was born, if you like, as cringy as it sounds. And in that moment when I was having a huge panic attack, there was something inside me that was like, we can't do this anymore. Like, we weren't born this way. There's a reason that I'm like this, and I'm going to spend my life trying to figure out what it is. Fortunately for me, my mum was quite alternative, and she was open to that stuff, and she had seen through her friend that she'd been helped by a clinical hypnotherapist to overcome their fear of flying, and she's like, "Why don't you try that?" And so I had nothing to lose. A young teenage boy, I'm sitting there thinking, obviously, that I don't want someone to make me, cut like a chicken, and control my mind. That was the last thing I wanted in that state. But I had no option, so I went to the sessions, and they massively helped. And within a few months, I'm getting back through the tunnel. I'm going on planes. I'm traveling to Dubai for an international school rugby festival, and I started to get my life back. And I'm sure many listeners, resonate that. When you have been faced with something that feels so impossible to overcome, and then you overcome it, the sense of empowerment you get from that is massive. And it really, planted a seed in me of like, what can this mind and body do? Like, I've seen the bad side of it, but I've now seen the good side of it. And I've done this in natural drug-free ways that were not, thought, I didn't think could help me, basically. And that really just kind of cemented this seed of like, I want to know more about that. And over the coming years, I just found this path into, found myself, after a brief stint doing sport and exercise science at Stirling University, I was like, this is not ticking the boxes. I want to know more about the mind and body and how to get the best out of it in drug-free ways. And unbeknownst to me, chiropractic was the perfect foundation for that. 5 years full-time, which may come as a surprise to some listeners. Some people think chiropractic, as you might know yourself, is like a weekend course, or a few months in there. Over 100 exams in multiple disciplines: neurology, physiology, biology, neuroanatomy, psychology, strength and conditioning. I mean, so much stuff that was teaching me about how the mind and body functioned and how to, get the best out of it. So, but as I got to the end of that 5 years, I wanted to know more and more and more. And so I did a 3-year postgraduate in functional neurology, because I was realizing that the mind and the body's, hard drive is the brain and the nervous system. So I wanted to know more about that and how to get the best out of that. So spent 3 years in London, in between, working full-time as a chiropractor, to learn about the brain. But at the end of that, I realized that a lot of how the mind and body function comes about from how the nervous system develops. And so with my development, I knew that there were obviously clearly problems from an early age. And I wanted to know more about that. So I did a postgraduate in Childhood Developmental Learning and Behavioural Disorders in Italy. And in amongst that, I did a degree in clinical hypnotherapy. So really, it's been this path of trying to understand the mind and body and how to get the best out of it, that now sees me where I am just now, where I've helped thousands of people from all walks of life, or many walks of life, should I say, and from all ages. And I mean all ages, babies straight up to people in their 90s, from cleaners to celebrities, to your Joe Blogs to your professional athletes. And whilst I have personal and clinical experience of this area, the greatest teacher has been professional and clinical experience. The greatest teacher has been my personal experience.
Just wanted to stop the episode just for 1 second. If you are enjoying this episode, then please can you help me by hitting that subscribe button if you're watching on YouTube, or if you're watching on Spotify, then please hit that follow button. It really, really helps this show, helps me to make even better episodes and get better guests on. Thank you so much for watching. Let's get straight back to it. What's interesting about your symptoms that you had is that they were progressively getting worse. That must, what was some of the worst things that came into your mind? Is that you were on that trajectory and not yet knowing what the solution was?
Especially as a young man, where you're very vulnerable to how you should be in life, and you should be confident, you should be hard, and my life was not ticking the average box. And I just remember again in that moment of panic attack where I was sitting there going, if I'm like this at 15, I think I was 16 at that point, what am I going to be like at 18, let alone 30, 36 where I'm just now. That was terrifying. It was also inspiring, because it was like, right, I'm going to devote my life to this. There's no other option than figuring out how I overcome this, and understanding why it happened in the first place.
So then why did you get into chiropractic? Because hearing that story, I would have thought that you would initially be thinking of something in the realms of mental health, psychotherapy. So why did your mind go to chiropractic first?
It's a great question. And I honestly, at the time, don't know. All I can tell you is that through my youth and being a young athlete, I had been helped by a chiropractor for injuries, and I'd seen like what they could do just with their hands. And I suppose there was a subconscious interest in how the body could be improved through natural means, and chiropractic clearly had some answers to that. And I noticed how that had affected my mood, and so therefore, maybe there was something in that there. But it was weird. I was doing sport and exercise science at Stirling University because I like sport and I like science, and no purpose to doing it other than that. Like, people leave school and go to do a degree, and that was the kind of conveyor belt I was on. And then my sister, who'd done law, had taken a year out, so she had graduated in law, and she decided that no, she wanted to do chiropractic because she'd been helped herself. And she had kind of opened the door to me realizing that actually there's more to this than just, helping someone to, be more physically active. But I really didn't understand what I understand now about chiropractic when I signed up. I just found myself taking a leap of faith, as it were, doing a degree that seemed to be better than the sport and exercise one that I was doing before. And as I say, in that first year, I just was like, wow, this is not what I thought it was. This is way more. And this ironically aligns perfectly for what I'm, trying to explore.
Yeah. And as you were saying earlier, chiropractic is not something that a lot of people know a lot about. And I'm sure that differs in different areas. I remember going to, generally most people I speak to, and I don't know if you get the same experience, but most people, they know of chiropractic and they know generally what we do, or that they tend to butcher the definition. But what I remember quite distinctly, I went to Birmingham and at this conference, and I told a group of 4 people that I did chiropractic, and I got blank faces on every single one of them. They didn't have a clue what it was. It's not an experience I've actually had very often. But as you said, it's a lot more than just a weekend course. You then went on to functional neurology. Can you define what that is for people that don't know what that is?
Well, it's just looking at the brain and the nervous system, looking at its functions, how it's designed to function, and helping it in drug-free ways to function better. So a lot of learning about, the pathways and the kind of almost like looking at the brain and the nervous system as like a roadmap and figuring out, what roads are there, and, when there's traffic on those roads, what can be done to clear the traffic, which is no different to, the chiropractic approach, where you're looking at, changes in the musculoskeletal system. But with the functional neurology, it really goes a lot deeper into the nervous system so that you understand the connection of that neuromusculoskeletal system and can kind of affect it at a deeper level.
And so what does that look like practically then? If someone came to see a functional neurologist, what does that look like examination-wise and treatment-wise?
So we would look more beyond just the muscles and the joints. So we would look at, how do the eyes move, for example? What are the reflexes? Not just your traditional reflexes like a bicep reflex or a knee reflex, but primitive reflexes that, that are survival reflexes that we all have. But ultimately, as long as the brain is functioning properly, they go by the age of 1, if not by the age of 5. And we look for the presence of those things, because if they're there, that's a great sign that there's, a big traffic jam going on. We would look at, sound, touch, people's sensations. There's so many different things that we would do. I've tailored my examination a lot from what I learnt. There's, I would say, loads of things that you learn. You can, heart rates, sound, heart sounds even, we dived into a lot of material. My kind of practice now is a lot more specific to the traditional kind of like, muscle testing and things like that, but also eye reflexes, the cranial nerves and things like that.
It's quite a holistic approach, really, isn't it? Because even though it's called functional neurology, the nervous system goes everywhere. So as you were saying, like you're assessing the cardiovascular system, like heart rate, etc. And why do we do that? Well, it's connected to the nervous system, and the nervous system controls it. So without the nervous system working well, effectively, not a lot works well in the body, does it? So your father is a medical doctor.
Yeah, just recently retired.
Recently retired, okay. So
and was my grandfather was as well.
Right, interesting. So you've got quite a line of medical doctors. So what was your experience then with medicine, with the problems that you were having as a young child, and then how did that then turn you into chiropractic? Because, well, I suppose earlier you were saying how your mum was into an alternative medicine. So what was the interaction then with your father in that side of things? So what did the medical side look like? Did you go into medications and that sort of thing?
Yeah. So, I mean, obviously, like any kid, you're kind of growing up at prey to what your parents do. And so, when I was struggling, the traditional thing is go to your GP and, take some medications for the problem, unless there's something else that they can do, which is usually not the case. That's their bread and butter is, here's some pharmaceuticals that you can use. Certainly back then it was. So that's what I did. It wasn't like I judged that or critiqued that. It was just, that was my option. But when that wasn't working, and the explanation that I was being given for what I was going through was basically nothing, like there was nothing to go on there, nothing that I could do, nothing that I could read up on, nothing I could understand, or make sense of what I was going through. That's when I had to look beyond medicine. My dad, very successful medical doctor. One thing he's always been very good at is being able to have an open mind to his profession. And, he would take me around, like he would do rounds, with his patients. And as a young boy, he would take me around and I would see him working with his patients and how he communicated with them and, and how much they loved what, he did for them. And so I recognized subconsciously that having an open mind towards what you do, not only helps you, but it helps the people that you're helping. And so I think because I had a mum who was very good at looking at the alternative stuff, it just naturally, I think, took me from medicine into naturally opening my mind to other things. But I wouldn't say I don't think it was a conscious choice. It was just I needed something else because what medicine was providing me wasn't working. It was helping to plaster over, the bleed, as it were. It would knock me out if I went on a plane. But as I say, there was this inborn understanding that I knew that there was more to me than that, and that I wasn't born that way, and there was something that could be done about it. So I think in some ways, whilst my parents helped influence it, from what I just said, I do think that there was me that was influencing that as well, and kind of who I am, as it were.
And you're basically just trying to find the answer, really, to find the
Yeah,
solution.
yeah,
That's
like
a good way to
anybody,
do it.
like
Yeah,
anybody.
exactly. So how did you get into well-being? You later then went into become a well-being coach. How did you get to that point?
Well, so what I was finding is when I was working, I worked in down south in Kent for many years, and as I was evolving my understanding of the mind and body, I was seeing a lot of patients that were coming in, and I was like, this is definitely to do with the mind, and it's their dizziness or whatever was going on is definitely being impacted, if not caused, by what's going on in their mind and their wider lives. And so I then started to use the strategies that I'd gained on mental well-being, and incorporated it within my chiropractic practice. The difficulty was I didn't have the time to do both. And I was sitting there trying to, treat their physical ailments that they presented with, but also trying to get at the underlying causes by doing some kind of, mental strategies with them. And that I saw the benefit of doing that, but I just didn't have the time to do it. So what I decided to do was do it online, or create separate sessions for patients to come in and do kind of coaching sessions. And so that was a kind of birth of it. So I'd work with different people, with fears or angers or whatever was going on there, to help them release that mental tension that was playing out in their bodies. So that was great. But as I moved forward doing that, I was realizing this is quite time consuming. And I thought I need to actually, assimilate this knowledge in a way that I can, help more people. And so I moved back to Scotland, started writing a book on this stuff. And what happened was I think because of the expertise, I was headhunted by the Scottish Rugby, Greg Townsend and his team to be their wellbeing coach. Word of mouth, they'd heard about me and they'd been realizing that, wellbeing was clearly an important area, a growing area in sport if you wanted to get the best out of people. And so I think they kind of saw me as that kind of expert, as it were, and invited me on to do it. But I think really it's just naturally evolved. If you want to help understand the mind and body and help people with that, it's probably going to evolve into that coaching, personal development world. Because really, the chiropractic, you're helping someone to personally develop. Ultimately, you're just helping them to clear the physical traffic that's getting in the way of them being who they are. And it was the same thing with the mental strategies I was using. So the coaching world just allows me to share that information that I've gained and coach people with it. So yeah, that kind of naturally evolved.
And what are some of the most surprising symptoms you've seen improve through doing these coaching sessions as opposed to the chiropractic sessions?
Yeah, well, a really obvious one that comes to mind is I remember working with a lady. She came in to see me in my chiropractic practice for dizziness and headaches and migraines and things like that. And we got on top of the symptoms quite quickly. We didn't get rid of them, but we got on top of them, like 50% improvement with the chiropractic functional neurology approach. But then we had a massive plateau, and I just couldn't not help her get over the line. She was still getting dizziness. And although it was better, still like at a level where, why is this like that? There's no rhyme or reason. And then I was scratching my head, and obviously with the knowledge I have on the mental side of things, I was just like, have you got anything going on in that mental area? Like anything? Like, no, I've not really got anything. Like, nothing at all. Are you sure? It's like, well, there's quite a lot of stress at work, to be fair. And I'm like, right, what? And so that was a seed to go, right, what is it about the work that's stressful? I don't know. I just stress. Like, no, what exactly is it? Well, it's my boss. He's like quite dominating, and you know, I, I I really struggle with his personality. I'm like, okay, why specifically? He's like, because I hate confrontation. And I just randomly decided to get her to stand with eyes closed, which usually she would, fall instantly. Now she was eyes closed, she was balanced. And then I got her to open her eyes and I said, now what I want you to do is I want you to think about your boss. And she closed her eyes and she fell backwards. Fortunately, I was behind her to catch her. But and I thought, right, well, we can instantly see now how what's going on and playing out in your life, which is 5 days a week. And she's thinking about this guy for the other 2 as well. If we can help you process your emotional charge towards that person, let's see what happens to your dizziness. And if we think about the symptom that she was presenting with, unstable, but also her symptom was when she closed her eyes, she was pulling back. She was demonstrating this pulling back from confrontation as soon as that image came to her head of her boss. So yeah, we helped her to deal with that, and her symptoms then dramatically improved beyond where they'd already improved. So yeah, the mind and body are one. So that's just there's loads of examples, but that's the one comes to mind when you ask it.
Yeah, and if you didn't have that knowledge, I think that's what I found frustrating, like particularly early on in my practice, is that you get very good in chiropractic college at dealing at the more mechanical side of things, and you get a lot of people just doing that. Every now and again, you come across someone that maybe you've improved so far, but you're struggling to get that extra amount, and you're just wondering what else is involved. And sometimes it's not just all one thing. It is incredible how much the body is actually connected. You mentioned, which I found quite interesting, particularly in regards to when I was thinking about inviting you here, was that you asked, I think it was on one of your blogs, maybe it was written from the podcast, I'm not sure, to describe yourself in 3 words, and you said mind, body, soul. What do each of those mean to you?
Well, when I went down this road into the mind and body, it was like a rabbit hole of, courses, degrees, clinical experience, and really is a rabbit hole when you go into that, like you just alluded to. There's not just one thing; it's this complex realm. Nutrition, there's so much stuff. But what I went in trying to learn about the mind and body, and what you come out with is learning about the soul. And I've heard that phrase before, mind, body, soul, and like sounds catchy, but really it's the mind and body that I was focusing on. And it's really been through my own experiences and an understanding about the mind and body that I realized that this soul thing is a thing. And actually there's ways of helping people with that part. And I know some listeners like soul might not resonate, and I think there are other words for it, self, that inner guide, there's other words for it. But soul is the one I think actually has been the most historical one used that actually is accurate. So really what soul means to me is that there is something sitting behind that mind and body. There's that person, if you like, that's in front of you. And really everything I try and do is to help that soul, that person, if you like, to be who they are, through helping their mind and their body. But it's their mind and their body is ultimately an extension of their soul, of their self. So that's where my, educational route has really evolved into, is learning more about that, and, the quantum physics and energy and all this kind of stuff, which certainly wasn't where I started. But as I've moved through mind and body, it's taken me more into that realm, which if you'd asked me when I was a teenager, you're going to be talking about the soul, or you're going to be talking about energy, I'd be like, what? Like, that is definitely not who I thought I would be now. But as I say, you learn about the mind and body, you come out with the soul.
Right, and you see stuff along the way, don't you? You experience stuff, particularly if you're seeing the amount of people that you've seen in the past. Like you can't not see that and try to put that together. And the incredible thing about seeing lots of people is that it helps you to get better at helping more people. Part of your mission, or perhaps your whole mission, is you stated many times is that you help people to love the life that they live. What is your advice to someone if they are, say, perhaps we take your situation. So when you were at your lowest point, when you were younger, with struggling with anxiety and that sort of stuff, or maybe just someone generally that is not loving their life, what would you say is the first step for someone? I mean, obviously this is going to be general advice, but or perhaps what is the advice you would give yourself back then?
That there's something inside of you that is greater than the problems you're going through. That would be the advice. And if you follow that, if you go looking for that, or look for people that can help you find that, you're going to overcome whatever's in front of you. That is definitely something that I would say to my younger self. Yeah, I think I used to say a lot, like, I help people to live lives that they love, and I say it caveated with this now, which I didn't before, which is that it's not really about living a life you love. It's more just about living. And living is about fulfilling your potential and being the best you can be. And when you do that, you'll have moments where you love your life. But I think what I used to do was say, like, yeah, I want to help you live a life you love. But I don't do that anymore, because I've learned in my own personal life that is not an achievable, sustainable thing. It's an achievable momentary thing to be in a state of bliss and love and gratitude for your life. Absolutely. Absolutely. But then to stay there and to never come out of that and to only ever be in that's something, I decided I don't want to sell that to people, because that's something I can't even do in my life. And nor have I seen anybody do it in their life. So now it's more about helping people to live, to fulfill their potential, to be the best they can be, to live inspiring, meaningful, fulfilling lives that they can love. Not a perfect life, but a life that they can love in spite of those imperfections. That's a different way, I think, than saying, I'm going to help you live a life you love, because I think it simplifies it into a way that people think that they should just love their life all the time and that they shouldn't have any problems. I've yet to find the recipe that allows for a life like that.
Yes, it's true. I mean, we spoke about that on the first podcast about happiness. And I think anyone that's lived more than a few years will know that happiness it's not a constant. Yeah. And actually, perhaps if it was, we wouldn't actually call it happiness, because you need the sadness to recognize the happiness. But we were also talking about, like, basing your happiness on something that is constant. And I suppose it depends on how you define it. Let's get on to then your position at the rugby team. What did that look like? Because obviously, as you alluded to earlier, Scottish kind of culture is quite hardened. I only presume. How was that for you, walking into then a rugby team, talking about well-being, and what kind of stuff? What did that practically look like?
Yeah, well, what it practically looked like was, it was a role that hadn't been done before. It was quite a revolutionary thing to do, and I was with people that were backing me to do it, which made it a lot easier. But essentially, it was about helping the squad, staff and players, to understand the well-being foundations. What does it take to be well, and what's involved in that, and educating them and raising their knowledge, because knowledge is power, and giving them beyond that a platform for one-to-ones to learn more and to actually work specifically on their own individual challenges. And so I would do lots of programs, lectures, presentations, and they would be on these well-being themes. So talk about purpose, talk about health, talk about relationships, talk about barriers and how to identify and overcome them on the field, off the field. And yeah, if you want to know more about you and your own personal challenges or purpose or whatever it might be, then I was there for one-to-ones. And obviously in the background, helping the environment. So, giving ideas about, how we can increase the environment that breeds a better well-being. But my philosophy was always clear, which is that, you know, if you help the person, you help the player, and if you help the player, you help the team. And so my role was to help the person. And it's not that in sporting setups that they don't care about the person. They very much do care about the person, in my experience. But obviously, the time that they're devoting to that person is different to the time they're devoting to the player. You know, because the player is not the person. The player is ultimately, you know, the guy with the skills and you know that performs, but it's the person ultimately that the player is. Yeah. So yeah, if you help the person, then you'll help the player. So, um, yeah, that gives you a little insight. I can give you more information if you want anything to know more on that, but that gives you an insight as to what I was there to do and how it kind of looked. Um, but the other question you asked was how was that in a hardened culture? Yeah, well, you think about it, you know, you're going in to talk to could be up to 50 odd, you know, blokes on their well-being, on their emotions, you know, from Scotland, a hardened culture, in rugby, a very hardened culture. You know, it could have been like a lamb to the slaughter. And it wasn't easy. And I'm not going to paint a picture that it was easy because it definitely wasn't. I had a lot of question marks on me as soon as I started and a lot of, you know, judgments. But what was helpful for me is that the people who were at the top driving that culture were backing me. So, you know, core group of players in the leadership group backed me. The management backed me at that time. And all of those things, you know, made my job a lot easier. And so the people who were questioning and skeptical were probably always going to be the people that were always going to be questioning and skeptical, and probably were till the end of my time there. But the ones in between, then because there was enough core back in it, then started to go, okay, actually, this isn't actually as crazy as I thought it was. Like, let's work on this. And yeah, I think the one challenge that I had, which you know nobody will have really appreciated, was you're a healthcare professional, right? And one of the core foundations to anybody that you work with is trust and confidentiality. And when you're in that dynamic, you're working with people who aren't healthcare professionals. And it's not that the trust and confidentiality isn't important, but it's not paramount. You know, there's some wiggle room, and for a role like that we do, there's no wiggle room. And so I would find myself working with a player and helping them to, you know, overcome something that not only helped them in their lives, but definitely helped them on the pitch as well. And couldn't say anything about it, you know, and they'd be asking, and you know, but I never felt like I could break that trust. And it's not like they were asking me to break this trust, but my level of trust, as it were, was probably different because of our profession and you know what we're legally bound to. So I did find that like the differences that were being made in the background, unless the players volunteered that information, which, and understandably at times people didn't want to because it was personal, um, and sometimes people did, but I did find that that was hard because a lot of the work that I would do, unless it was through presentations, was unseen and unknown about. And ultimately, that doesn't matter to me because I'm helping the person. I'm not interested in, you know, reputation or things like that in that environment. I'm there to, you know, help the person, and I do mean that, which is why I had that confidentiality. But I think it probably minimized the importance of the role or the effect of the role in that I didn't share that information. Um, so that I did find that a challenge, because then you know the rationale to do more presentations and keep drip feeding this information and building this understanding is there's less weight to that. Yeah. So if somebody thinks, oh no, we don't need that, then it's no, I think you do, but you can't back up why as easily. So you're kind of reliant on people talking.
Yes. I suppose, as you say, it's a new role, and with any new role will come challenges. I suppose you don't necessarily know what you're walking into. I mean, was it a nerve-wracking thing to consider, or were you quite confident from the start? I mean, how much difference did you think you can make from the start?
I knew I could make a difference. Like I knew it for years, and like look, anyone who knows me will know that like growing up, rugby was everything to me through my teenage years. Like, it was when I was struggling, it was something that was like, it really helped me. Playing it, watching it. And the Scotland rugby team, other than the British Lions, were the two teams that were the teams that I just followed 100%. And I always knew that, God, if they just knew some of the stuff that I had been exposed to, fortunately through my own struggles, I knew that I could help them. And it was kind of unbelievable that I found myself in that role, having not gone looking for it. So I knew as soon as I started, I can help these guys 100%. But so I was confident in that. Of course, you're a bit nervous going in, but like, what was difficult is that it was during COVID. So I'm there in front of everybody with face masks on, and you can't gauge how are people taking this, or how are they responding initially. So that was a challenge. But no, I think ultimately it was it wasn't that I wasn't confident, but I did find that the challenges that I couldn't foresee in that role did challenge my confidence. Certainly challenged my own well-being 100%. Because as I say, it was a new experience for me. It was a new experience for them, and there were things that weren't easy, for sure.
One of the things that, I mean, mental stigma has been around a little while, which is interesting because if you go to a chiropractor or anyone for a physical health issue, go to a doctor for a physical health issue, often there's not much of a stigma there. But if you have a mental health challenge, anxiety, depression, or whatever, there seems to be a bit more of a stigma on that side of things. How do you, I mean, also particularly with the type of work that you've done, is that a stigma that you see, and how do you see that changing now? I mean, the fact that you have now gone to the rugby team and done your role, could you have done that 20, 30 years ago, do you think?
No, I don't think I could have done it 20, 30 years ago. And purely because the general understanding there was almost the opposite of what's being encouraged now, which is like, just don't speak about your problems, don't open up. And if you do, there's something wrong with you. You're a bit nutty, type of thing. And I've definitely seen those stigmas 100%. And as I said, I think there are those people that still have those stigmas in those environments 100%, whether it's in the staff or whether it's in the players. Yeah, it's in any walk of life, you're going to find people that have those stigmas. But there is enough people who don't have those stigmas and are really helping to make the people that do have the stigmas not the norm. And that really opens the door for people who are somewhere in the middle. And there was definitely enough of those people in those environments, 100%, which is great.
What do you think then happens when you do open up? Why have we gone from keeping in to opening up? Why is that helpful?
Because keeping it in doesn't work. It doesn't work. You can get by, you can get some results, but if you're interested in, being who you are and being the best, to your ability, you have to open up. You have to ask for help because you don't know everything. And you can try and do it all yourself, and I've been that guy. But you're gonna need dialogue with people. You're gonna need to open up, and it doesn't have to be everyone. It doesn't mean you have to go and see a coach or a counselor or psychiatrist. It doesn't have to be that. Although there are obviously options on the table. But opening up is just like you're liberating that stuck energy, that stuck thought process. You're bringing it to the table. You're in talking about it, you're allowing yourself to feel it. In talking about it, you're allowing yourself to process it. And the other person doesn't sometimes even need to say anything. It's just the process of doing that helps the mind and the body to heal. And then if they can then give you a strategy that helps pull you out of that pit you find yourself in, even better. The one thing I would stress though as well is that, and I find this when everyone talks about mental health, is that people think that you only need to do something like that if you've got a problem or a severe problem. You don't have to. That's not the only way you're going to get benefit out of seeing, opening up or speaking to people. Far from it. You could be feeling really good, but you've got a goal that you want to achieve, or you know, and you want to explore what might be in the way of that. And like seeing people to help you to fulfill what you're after is just as important as helping you to overcome a barrier, you know? So, or a fear or a depression or whatever it might be. These things are, I always stress this, you know, that they're not just for when problems hit. Life is always. And so you're always going to have times where you could benefit from opening up and speaking to people and gaining their perspective and seeing things from a different side.
There's a parallel there with chiropractic, isn't there? I mean, often people come to us because they're in pain, but once they're out of pain, you can take them up the next level, particularly if they have to perform something, whether that's a job or a sport or whatever. I mean, if you can, even as simple as increase their range of motion of their hip, you could effectively then improve their golf swing, or, you know, those sorts of types of things. And it makes total sense that mental health would have that parallel as well. You could get someone out from the pit from depression or anxiety or whatever that may be. But you could also actually get them above that to be able to achieve things that they actually want to achieve, but they're kind of stuck.
Exactly. And again, chiropractic is a great example, as you say. You know, we're constantly seeing people go from pain to better, and then from better to better than that, to better than when the pain, before the pain started. And so working on your mind is the same thing.
Mm. You mentioned that sporting barriers are often a life barrier. Can you explain more about that, particularly in regards to the rugby?
Yeah, well, a lot of people will say, you know, like, what are the main challenges that athletes go through? Like, what are the typical challenges, the barriers that they face, the things that get in their way? And I'm like, it's the same thing as what gets in the way of a cleaner, you know, or a bin man. Like, they're human beings. And so, you know, sport, the challenge with sport is that it's high performance. And as a result, there's this undertone of elitism because it's elite sport, right? And nobody's consciously doing it, but there's this thing of like, well, we're professional athletes, so things happen a different way, or we're running a group of professional athletes, so things work differently here. You know, how could you know about what, you know, an athlete needs on the field, for example, if you've not been an athlete yourself, or if you're not trained in what it's like to be on the field? And that frustrates me because it makes no difference. Their rugby is a hologram for their life. Their footballs are hologram for their tennis, their whatever it is. And don't confine them into just sports psychology, you know, because the barriers that they find within the sporting psychology world are ultimately just life barriers. Their fear, their anger, their guilt, shame, grief, infatuation, you know, self-doubt, low confidence. Like, these are things that anybody face. They just so happen to be a professional athlete. So, you know, when we work in a chiropractic practice, if a patient comes in, say it's an accountant, and I say to them, oh, sorry, man, I can't treat you because I've never worked with accountants before. But what? Yeah, but you've worked with headaches, right? Like thousands of headaches. Yeah. So why can't you help an accountant? So it's the same thing within sport. They're like, no. You have to either have been a professional athlete, or you have to be, you know, a sports psychologist, as it were, which of course is valuable. Don't get me wrong. There's a value in that, but it doesn't have to just be confined to that. And really what I tried to introduce was, let's go past sports psychology here. Let's include it, but let's look beyond that. Let's look at life psychology. Because so many, if all the players that I work with, whenever there was a problem on the field, it was ultimately a manifestation of something going on off the field. And so, for example, I'll just give, this is just one example, but it's a good example. I worked with a player who was struggling with going up for a high ball. And so in rugby, ball's kicked up high, and often they have to jump up and catch it. It's quite a dangerous thing to do, and a very skillful thing to do. And this player had all the skill in the world, you know, international athlete, but he felt himself freezing any time that he was going into that act, and he didn't know why. And so that's why he came and asked the question. And through questioning that I do, we established that it was because he was worried about letting his coaches down, right? If he dropped the ball, and he didn't want to let his coaches down. But that was because he felt like he'd let his dad down when he was younger. And so it had nothing to do with going up and getting a high ball. It had nothing to do with the rugby. It had to do with what that represented to him in his life. And so helping him to deal with that, the challenge of letting people down as a life theme, helped him to then overcome the fear of dropping the ball, or the fear of going up for a high ball. And, that then became, he got on top of that and his performances went up as a result. And so I really stress that, to any athlete, to anyone in their field, that your barriers may look like they're related to what's going on. Like, for example, my fear of flying, it looks like it was related to flying or tunnels or enclosed spaces. It has nothing to do with those things. It had to do with the fear of losing control. And so as chiropractors, we're always trained to look past the symptoms and look for the core of the problems. And so when it comes to coaching and helping people in their mental health, it's the same thing. That's why I know that a lot of these sporting barriers are ultimately life barriers.
Yeah, that's really phenomenal, because you're somebody that I think has put physical and mental health quite well together. And just even the way that you're speaking there, I can really see how you're asking the question, which is exactly why I got into chiropractic as well, is what is causing your problem? And you're not just asking it, but you're actually going after it and trying to go as deep as you can, because the easy thing to do, and this is why I got a lot of sympathy since doing my job. I've got a lot of sympathy for GPs, because they get a very short amount of time to see people, and they don't have the time, like you, they don't have the time to spend diving into these deeper issues. And so they end up just giving medication, which we know is not the most ideal thing, at least for getting to the cause of the issue.
Yeah.
But my next question is, we've talked a lot about well-being. How would you define well-being?
Well, if you look at the word well-being, so it's about the being, it's about the person, and it's about the self, and whether they are well or not. So what does that mean? Well, well-being is essentially about how well someone is doing at achieving what they want in life. So if we simplify this, there's 7.5 billion people on the planet, nearly 8 billion people on the planet now. And we all share a common desire deep down. And that is that we all just want to live our lives. We just want to live our lives. We want to have them be meaningful, inspiring, fulfilling lives that we can love. And that's all we really want. And we all have different forms of doing that, because we're all unique. For some people it might be through sport, some people it might be through accountancy, some people it might be through being a father, or whatever. We've got different ways of doing it. But ultimately is we just want to live our lives and be the best that we can be. And well-being is a measure of that. How well are you living your life? And that's why, for me, speaking about what is involved with that pursuit, what are the core pillars that I call them, the 4 pillars, that somebody needs in order to be well, in order to have strong well-being, in order to live that life that they're after. And for me, I break that down into 4 pillars. The first one that we all need in order to achieve well-being, in order to be well, in order to live our lives, is we all need a strong sense of purpose. We all need a sense of who we are, why we're here, and what it is we'd love to do. Something that makes life inspiring and meaningful to us. We all need that. And these pillars, are true for everyone, everywhere, throughout all of time. Purpose. Number 2, we need our health. We need access to the physical and mental abilities to survive and thrive and be who we are, and to fulfill that purpose. So we need our health. Number 3, we need high quality relationships. High quality relationships, number 1, with ourselves, other people, and in the world around us. And the number 4 is that we then need to be able to identify and overcome any barrier that gets in the way of those 3 things. And all barriers ultimately are mental and based on our perceptions. And those things, as I've alluded to earlier, are fear, anger, guilt, shame, grief, infatuation. These are the typical type of barriers that we all go through and we all experience in one area of our life. or more. And so you need those 4 pillars in order to be well. But being well is ultimately about, and well-being is ultimately about how well are you living your life.
Yeah, I mean, it's quite self-explanatory, really, isn't it? It's living a life that actually it's actually something we all want to live. And it's quite sad, or yes, lack of a better word, but sad when you start to see people in situations where you know they could be living a better life than they are, but they're almost stuck. And I suppose what your part of your job is to help people to get out of that stuck situation. In a similar way with chiropractic, again, I always feel like it's, a lot of symptoms that people have, they can manage themselves a lot, or they can do a lot to prevent themselves. But what we're really there for is to get people out of that sticky situation, so then they can kind of go to excel and go
to the next level.
Go to the next level.
And that's it. And it's not about a perfect, being perfect or never having problems. Far from it. I mean, it's at risk of portraying that image. But, symptoms, for example, and having barriers, for example, in life, that's not a sign you're not well. That's just a sign that you're getting feedback about some changes that need to be made. But if you get stuck in those states, that's when your well-being is now starting to, you're starting to come off those pillars. And you're starting to fall off that, and your ability to live your life and be your best, you're off track.
Yeah. So let's go into those barriers then, because there are, from my perception, there are some people that can go through a certain trauma, and for example, PTSD, something actually we spoke about in the last podcast, and I think they said that something like 25% of people experience a trauma go on to experience PTSD, which I find very fascinating, because you experience the same thing, but you interpret it in a very different way. And some people carry that trauma and some people don't. Is there any characteristic, anything inside somebody that helps them to be more resilient to those symptoms? I.e., like, for example, why is it that you experience that anxiety and someone right next to you didn't?
Yeah, it's a great question. It's not an easy answer, but so it's based on your life experience up until that point. So I had the reaction I had because my life up until that point had been fueled by fear. There'd been a lot of events. Don't get me wrong, there was great things as well, but there was a lot of fear and anxiety and anxious energy and a lot of stress. And I feel like that first panic attack was that I just reached the end of my threshold. I couldn't take anymore. It was just that straw that broke the camel's back. And so had I had it happened without 25% of what had gone before it, would I have gone into a panic attack? Almost certainly not. But the panic attack was my body saying, enough. We can't do this anymore. So it's always about what buffer do you have? Where's your buffer? Like, we can all take stress. We can all handle it. But if your threshold is very low because you're pushed right up against it, then a certain circumstance is going to be really challenging for you. Like, for example, me being in a crowded room, couldn't do it. Me being on a plane, couldn't do it. My threshold wouldn't allow me to deal with that. Now my threshold's gone up, or at least my stress level's gone down in comparison. And so now I've got more of a buffer. And so those environments, whilst I might not like them, I don't mind in close spaces, and I can go on planes all around the world now. But I wouldn't say I love flying. It does cause me stress sometimes. But my buffer's, greater. And so, yeah, I think ultimately it's our life experiences up until that given point, our knowledge base up until that given point, that dictates how we respond to that situation.
So is it life experiences you think that brings that buffer up? What brings that threshold up? Well,
life experience can push you to the threshold, and it can also increase the threshold. So it just depends on what the life experience is. So I don't know if that answers your question. But
yeah. So I suppose it depends on what you learn from that life experience.
Yes.
Is that, and depending on then the trauma that life experience has on you will depend on then how close you get to that threshold.
Yeah, so I'll give you an example. So, my life experience, I had a lot of love, right, from my parents, a lot of love from my family, but there was a lot of trauma that was going on in their lives and my life. And as a young child, I didn't know this, until I did, the studying in it. But for a young mind, one of its essential needs is a need for safety. And if you've got trauma going on and people who are like having breakdowns around you and divorces or whatever it might be, and physical traumas, whatever it might be, you're in that environment, that child is going to struggle to feel safe, in spite of the love that's there. And that's what definitely happened with me, is I grew up most of my life with a dominant energy of fear. And that kept chipping away, and building and building and building, to eventually any other risk of not being safe, like not getting out a tunnel or not being able to get out of a plane, you just can't handle it anymore. We all have thresholds, and I'd reached mine. And that was because of my life experiences up until that point. Now, I'll caveat that with, in spite of all the fear that I was going through, I was also being taught about what to do, what not to do, subconsciously. And so then that actually helped me to get out of it. So I'm not putting myself into a victim here. I wasn't a victim, but there were things that happened. And ultimately, I think if we can then turn those experiences, listen to our body's feedback, and then go, right, what do I need to learn here? What can I learn? How can I turn this challenge into an opportunity for growth? That's the thing that then helps someone go from a low buffer or a high stress, or a low threshold, should I say, and a high stress, and then widens the playing field. Because they see it as an opportunity, something that's on the way, not in the way.
Yeah, that's interesting. That does make sense. If you inherently don't feel safe, you would have a reaction, wouldn't you?
Yeah, I mean, I was that kid who would walk around, would go to the park and all that kind of stuff. But as soon as I was walking home and I wasn't near my friends, or I was only with one or two, or we were in a dodgy environment, constantly on guard, constantly on guard. And I, just never really felt safe. And the only place I felt safe was my own home. And then eventually so much became so stressful in my life that I couldn't handle it anymore. And then even my own home wasn't safe, because then I had a, panic attack in my bedroom. So, but again, all of these issues were helping me to realize that I needed to stop and make a change, that there was something there that I needed to learn in order to go to the next level, or in order to, grow. And that's really what all these experiences are, good and bad experiences, is they are ultimately feedback that is helping us to try and learn something. And that's where that soul kicks in. That's where that inner guide has, that we all have, is essential, that we know how to reconnect with that. Most of us don't even know it's there. And yet we speak to ourselves more than we speak to anybody else. So intuitively we do know that it's there, but we're not tapping into it. And so for me, when I described that situation of being in that panic attack when I was a teenager, and then a moment of light came, and I heard that voice within saying that I wasn't born this way, there's something I can do to change this. That was my inner guide. That was myself. That was my soul, if you like, coming to the table and giving me insight that I needed. And I've subsequently learned better how to connect with that part of me. I've learned the hard way, because I've just communicated to the things I went through in my teenage years. In recent years, I've gone through huge PTSD, like huge trauma. And, my well-being's taken a battering, in the last, 6 years or so. And I've had those traumas, though, were ultimately opportunities for growth. They were helping me to realize that you can learn all you want about the mind. You can have all the skills, all the knowledge about the mind and the body. If you don't know how to connect with that soul, with that self, none of it matters.
So that explains why you said earlier how your mission just changed slightly because of your own trauma that you went through.
Yeah.
What is it that you went through?
Yeah. So I've gone through quite a few things in my life without playing, the violins. I have gone through quite a few things. But I was basically when my son was born. We'd gone through a few challenges, with my wife and I falling for her to fall pregnant. Um, we had 3 miscarriages, and one of them was very traumatic. She, lost a lot of blood and passed out in my arms, and that was a challenge. But when my son was born 6 years ago, it was very traumatic birth, and I nearly lost my wife and I nearly lost my son in the birth. And I didn't know I had PTSD until probably 2 years later. But that happened. We moved country. We moved back to Scotland. I didn't have a job because I had no job to come to. Nor did my wife. So we were jobless, trying to make new roots in Scotland, living with my mum, who was struggling at the time. And we had 2 family members that were murdered. And, you know, there was just a lot of stuff. I wasn't sleeping. I was up 5 times a night for 15 months. My son didn't sleep well. It was not good. My wife had an anaphylactic shock because she had postpartum thyroiditis. It was nonstop. And then 2 years into that process, I realized that I wasn't coping, and I was really struggling. And I started to develop like a lot of anger, um, because I'd been that kid who'd spent all these years trying to figure out about the mind and the body and how to be well. And there I was with that knowledge, helping thousands of people to do it and unable to help myself. And it was very unpleasant time. And don't get me wrong, it wasn't like this all the time. And a lot of people that know me wouldn't have even known I was going through it. Like 80% of the time I was fine. But 20% of the time I was, really not fine. And my second son was born, and another traumatic experience. He was born fine. This time it was a C-section because of what had gone on before, and he was born fine. And then my wife hemorrhaged and lost half her blood volume and nearly died. And I had to watch as my wife was wheeled out of. We'd literally just been speaking to people on the phone, like, "Hey, here he is," and all this kind of stuff. And then she hemorrhaged, and she was wheeled away by like 6 doctors, and there I am with my newborn baby, as she's reaching out to us and thinking, the worst based on what we've been through before. And I was sat there with my new born boy, and just bawling my eyes out. So pleased that he's here with me, but thinking that I'm potentially, not going to be, with my wife anymore. And that might all sound a bit dramatic to people, but that's, the experiences that I went through. And it was just like wham, 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 wham over a few years of, intense trauma. And as I say, the thing that I found the hardest was having the information, the knowledge that I did have this time, that I didn't have when I was 15, but I did in my 30s, and helping all of these people. And as I say, not being able to help myself just fueled me with anger, fueled me with rage. And when you have proper PTSD, you can be feeling totally fine 1 minute, and then there's a noise, like a dropping of a pan. You're cooking and you just like the pan makes a noise, and you can go from feeling all right to being like rageful like that. And that was a very new experience for me. I'd never had anything as bad as that before. And I tried everything to help myself get better, but was struggling. And then I developed chronic pain. That was just like the icing on the cake. Intense rib pain, joint pain, and that my chiropractic couldn't even help me get over. And all the knowledge of the nutritional stuff, of physical stuff, like none of it was getting me better. And that plus the trauma just almost sunk me. And I was doing all this, like doing 2 jobs with 2 kids, not sleeping well, and it wasn't easy. But there's a long story to explain that the thing that changed for me was the realization that I had all these anger voices and rageful voices or frustration and depression or whatever. But I knew that I still had something more balanced and more integrated within me. Something that was still beating my heart, was still making me breathe. A loving force. And I, through getting help and asking for help, trauma counseling and EMDR therapy and things like this, I found a way into connecting with that voice. Not in the way that actually they were trying to help me do it, but I found my own way, if you like. And that took me to that inner guide. That took me to the voice of the soul, as it were, the voice of oneself that isn't fearful, that isn't rageful, that isn't angry, that is just loving and grateful. And we are so many of us are so disconnected from that part of us. And true healing is about helping people to reconnect with that part and overcoming the things that get in the way of that part. And when you do, you start to raise your potential. You start to come back online, and pain starts to get better, and trauma starts to go away. And am I 10 out of 10, like all guns blazing now? No, I'm not. Do I still have challenges? Yes, I do. But am I exponentially better as a result of knowing how to connect with that inner guide? Yes. And that's now really informed what I do for people. And really, I'm helping people to learn techniques that bring them back to that.
Would you take that away if you could, knowing that you would also take away everything that you learned?
No. I wouldn't take away anything that I've gone through in my life. Someone said to me before, like, if you could go back in time or go forward into the future, which would you choose? And I was like, future. And they're like, what? Why would you ever do that? It's like, because if I went back in time, I would be devoid of a lot of the things I know now. And so all the trauma, all the pain, mentally and physically, have all taught me stuff, which has been a game changer, which has helped me to help other people better and become more of an asset to the world. But help myself better, and most importantly, my kids. I'll be able to share experiences with them and not paint just a rosy picture of life. Life's all awesome. There's hardships, but you can learn from them. You can grow from them. You can learn things that you would never have learned if you didn't go through those things. And that's, as I say, it's taken me to life experiences and knowledge and teachers and mentors that I would never have had access to had I not gone through those things. So I'm really grateful for that.
That's very fascinating, because I heard that they did a study on this and asked people that question, and it was something as crazy as like 99% of people said they wouldn't change it because of what they learned. And somebody, I mean, like yourself, like gone through some horrendous things. What is the most important thing that you're doing now, or perhaps maybe should be doing now, but I'm sure you are, to help your kids not go through what you went through, particularly in regards to anxiety?
I try and observe who they really are. And I try and nourish that. And I try and, I look at what do they value, and I try not and put rules down. Like I was always a rule breaker or a rule bender. Like I hated rules. I still hate rules. Guidelines, different. That's different. There's some wiggle room there. And that is helpful. Rules, more imprisonment for me. And I try not and do that with them. Like just find their way, guide them, yes. Have boundaries, absolutely. And have some discipline, yes. But I just try and I see my role as nurturing, not dictating. And what am I nurturing? I'm nurturing their self, their soul. They're unique. There's been no one like them that's ever shown up in the world, to my knowledge. And I want to celebrate that, and not put any shoulds or ought tos onto them. So there'll be other things, but that's the thing that comes to my head.
Yeah, because it seems like that parents have a big role, obviously, on how their children grow up. But I remember Jordan Peterson saying that your job as a parent is to mess your kids up as least as possible, which I find hilarious.
Yeah.
It's like assuming that you are going to just try and minimize the damage,
Yeah.
And I think that's also something we have to be quite mindful. You can always think back to your own childhood and think, my parents didn't do that, or they didn't do this, and if they did this, I would be like this. But I mean, I haven't got kids yet, but I'm sure you can attest that when you become a parent, it's impossible to be a perfect parent, and it's just so important not to blame them for those things.
Oh, 100%.
And try and be better.
Yeah, 100%. They're the greatest teachers of all. You know, what I've found in being a parent is that kids almost come in and ignite the parts of you that you need to grow, and there's such a gift, you know, and that is such an unseen gift and an untalked about gift. They stir up sometimes the worst bits of you to help you to grow and learn from them. And realize the bits that you've not dealt with, that you are carrying. And, you know, that in amongst obviously the pure joy that they bring, and obviously the stress that they bring as well, they do that for you. There's such a growth factor, you know, as it were. One of the things that came to mind though that I wanted to say was that, you know, perfect parenting and all that kind of stuff. You're right. You do. You're going to have things that happen to you, that you do to your kids, that you're just like, I can't believe I did that, or I can't believe I said that, or you know, I remember being on holiday, you know, and something had happened, and I was you know, going through a bit of a challenging time at the time, and my son had a water pistol, and I'd said, "Oh, please don't get me that. I don't want that right now." And you know, of course, he did it to me, and I was like, "Logan!" And I shouted at him. And I was so triggered by it that I then like picked him up, started to walk away. And as I was doing it, I started to calm down. I'm like, what am I doing? Put him down. I was like, I'm really sorry for shouting at you. Like, that's not right. But I did say to you, don't do it. And, you know, you go through the process. But I remember my wife saying to me, like, everyone turned around and looked at you and like thought, what are you doing? This kid's like 5. And they were right. You know, like I'd let myself go in that moment, but I'd made a repair. And that is such a big thing that I don't think a lot of people do, or at least know the importance of. If you inevitably, or when you inevitably make a mistake and quote unquote mess your kids up, as it were, make a repair. Make sure you go back and address it. Don't just be like, you know, yeah, I told him not to do it, and you know, like almost kind of reinforce your own behavior. Go in and be like, no, I actually messed up there and I'm really sorry. That goes a million miles. And kids are so forgiving. They forgive you instantly anyway. But you've taught them actually the importance of saying sorry, of owning your mistakes, and that mistakes don't have to be the end of something, you know, that there can be a follow-up. And my great aunt Molly, before she died, she lived her life, and she had this quote, which was, you know, it's not, you don't get to decide the cards that you're given, but you get to decide how to play them. So play them well. And if you mess up your kids, or you give them challenges, or your parents have given you challenges, they're your cards. How are you going to play them? Turn the challenge into an opportunity, and then you'll keep growing. You know, life is about feeling, learning, and growing. And we don't just grow from the good stuff.
Yeah. Being a married man myself, my perception of life is that going from single to married, you increase your challenge in life. And I remember I think the reason why people say first year of marriage is difficult is you're just learning how to live with another human being, which is, when you're close to another human being, is not the easiest thing. Because I think one of the things I learned about myself was that I wasn't as humble as I thought I was. And that was only because that when you're single, you're not challenged to that degree. When you're married, you are. And the way I see kids, which is my next life stage, is, from what I hear from people, is it's like a step up. It's like the next challenge. And it's almost, I think it's good or ideal, let's say, when it happens like that, when it's like a gradual process where you can start to learn in small doses rather than being chucked in the deep end and you having to, you know, a challenge, I suppose, can be too much. But as you were saying, it's what you learn from it.
Yeah.
That's really important.
Yeah, and like my jump from being not a parent to parent was not a gradual jump. It was like whoosh, into the deep end. Here's some drama for you. Here's some not sleeping, for 15 months, up 5 times a night. So it was a baptism of fire, but it was also the greatest thing ever. So, and that's life, isn't it? Like, parenting is just an example of that. That there's hardships, there's challenges, but is it all worth it? Yeah, if you've got something that you love, yeah. And we all have something we love ultimately, whether it's something we love doing, we might become disconnected with it. But that's what I'm talking about that soul, that inner guide. You need to reconnect with it because it's there.
So we're coming to an end, but what is the most important thing that we haven't talked about yet? Is there anything on your mind that you want to say as we end?
Good question. I suppose the question I have for you is there a part of what I've talked about today that you want to know more about, or a specific life question that you're going through, or how do you overcome this particular thing, or anything that I can break down for you?
Actually, yes, there is. That is a good question. So I mentioned this actually on the first podcast briefly, and so you may have seen it. But I came across something in my practice that I was very bewildered by, and I don't fully understand. But when you were talking about what you were talking about, it made me realize about those life barriers. So within chiropractic, as you're fully aware, we do adjustments. And what I've found, and this happened quite suddenly, is that with my neck adjustments, absolutely fine. Like it takes a long time to be able to really hone it down and get good at it. And I got to a point where the skill of it, me knowing what to do, how to do it, was it got to a good place. And then almost like overnight, came into practice and set up, and I was about to do the thrust, as in the movement to create the adjustment. And it's almost like I couldn't tell my brain to make the movement. And yet, if I went to a foam roller and I did that movement on a foam roller, it was not absolutely fine, almost like it's what it was before. And it bewildered me because I was like, why can I do it on that foam roller? And why can I not do it on a person? This has gone in kind of ups and downs, and it's not quite as bad as it was.
It occasionally comes in.
But does occasionally come in.
Yep.
And automatically what tend to happen in my mind is it's almost like you're really like trying to do more. So you end up tensing up your body, and then you kind of just have to stop and say, no. I don't know if you've got any thoughts on that. Why do you think that happens?
So, what you've just described is what happens to people in any form of performance, so elite athletes that I've worked with, this is a very similar thing that can happen. That guy that I described going up for a bottle, you start to freeze. So ultimately, what you are about to do there, subconsciously, because you're not conscious of it, right? Because you don't ultimately know what it's about. Subconsciously, it's registering that what I'm about to do right now is a threat to what I value most. Now, I don't know because I've not asked you, but it could be, as an example, what if this doesn't help the patient get better? What if this helps the patient get worse? And then that then could risk my current financial situation, which is not as good as it was, say, 6 months ago, as an example. And so in that moment, of course, your body's like, this is a threat to something we value most. I'm not going to do that. So what you need to do is almost observe in that moment, what is it? What is the emotion, first of all? And then what is that emotion ultimately about? So if I ask you that question, is there anything obvious that comes up? If you think about yourself in that moment, when you're about to adjust that patient in that way, what is you've got the physical sensations that you can sense. What is the emotion attached to them?
It's probably, it's sometimes hard to put into words. It's perhaps goes around confidence, which was a big thing when I very first started. And actually, what I didn't say was that this happened when I very first started. but it was also happening as my skill of the adjustment was improving. So then so I just assumed it just because I wasn't very good at it, and I was just, getting on that path, getting better. As I got better with the adjustment, that kind of went away. I thought, great. What was weird was it just came back very suddenly. And I almost wonder, maybe I'm jumping back to when I first started, when you naturally don't have that confidence. You're asking the questions of, as you say, is it going to make the person better? Is it going to make the person worse? Because what is interesting is that this doesn't happen in lower down on the spine. It happens with the neck.
Yeah, which is obviously where chiropractors are obviously people have got their red flags around. Yeah. So, and as a chiropractor, you can't help but be aware that there's, a minority of people who want to say, oh, you could do damage when you do that. And so naturally that's going to be the area that will tap in to the part that's sitting and not feeling confident. Yeah. So would you say that that's what it is? It's a lack of confidence in that moment. Is that the emotion? Because you got to be clear on what that is.
Yeah, that's what I find difficult, because at the beginning I'll say absolutely, but when it happened a number of months ago, I didn't notice a change of anything during that time. It's not like I don't think I would have suddenly lost confidence in that time. So I almost wonder, maybe I just jumped back to,
okay.
I don't know.
Would you be happy if I did something with you for 5 minutes?
Go for it.
So what I want you to do is close your eyes, and I want you to put your awareness in the center of your chest, just to ground you. Let me know when you got the awareness there.
Yeah, I'm there.
And then I want you to just breathe in and out of that area. And then as you do that, I want you to allow yourself to feel those sensations that you get in that moment. And let me know when you start to experience that. And I want you to just describe to the listeners, where do you feel all this? What are you feeling right now? Is it tightness? Is it a burning? Is it a heat? Is it in your arms, in your head? Where do you feel this?
Feeling my fingers. It's
Yeah. So where the adjustment would be. Yeah.
Yeah, that's true.
Okay. So describe the feeling in the fingers.
Like almost like it's losing blood.
Yeah. Like a draining.
Yeah.
A coldness.
No, almost the opposite.
A heat. And what I want you to do, just keep the awareness in through that kind of chest center. And what I want you to do is describe the emotion that comes with this feeling.
Probably nervousness.
Yeah. Just see if there's anything else. Is nervousness the right word?
I think so.
Great. Now, what I want you to do, keep breathing in and out of that chest. And there will be a voice associated with the nervousness. I want you to let it communicate to you what it's nervous about.
I think it's something along the lines of worry that I won't get the results that I'm after.
And ask it, why is it worried about that?
Yeah, that's interesting. I don't know, it just came to my mind that with chiropractic being in my family, almost like an expectation.
Yeah. Is this an expectation that you felt right at the beginning of your career when you were
Yes.
in that moment when you were really struggling initially?
Yes.
Yeah. The weight of expectation to meet your family's expectations,
Yes.
or at least the expectations you have on yourself based on your family having a long line of successful chiropractors.
Yeah, more the latter.
Yeah. Okay. So first of all, just breathe through that. Just breathe some of that out. And as soon as you start to feel just a little bit of a shift in how the fingers feel, let me know. They might intensify to begin with, but just breathe out that.
Yeah, I think it did change at the beginning.
Yeah, just a little, even if it's just a little dialing down. Doesn't have to be everything, just a little bit. Just let me know when you get to that point.
Yeah, if anything, it's more of an intensify.
It's intensified to begin with?
Yeah.
Good. And that's probably because you're connecting with it. So breathe through that. Like, let those feelings be there. That's almost part of why it's staying stuck, is that you're not allowing it to fully go through. So just allow that to happen for a minute. Let it keep coming through. Anything else that comes? Good.
No, but I think I'm feeling it less than my
Starting to calm a little bit. Now, what I want you to do as that's calming down is I want you to keep your attention in that kind of heart region. And then what I want you to do now is just, we're not ignoring that part that you've connected with, but I want you to just connect with the balance part of you, the part that will feel more kind of like, it won't feel this way. It'll feel like loving. It'll feel joy, gratitude. If you need to think of someone to allow yourself to feel that emotion, then do that, or an experience you've had. But just breathe in and out of that heart and just allow yourself to feel one of those emotions, love, joy, or gratitude, and let me know when you've got it.
Yeah, I got it.
Great. Now, there'll be a voice associated with that, right? That is essentially your inner guide. That is ultimately, that integrated part of yourself. That is who you are. Now, let that voice communicate to the part that's nervous and see what it's going to say. And just let me know when you start to hear what it's going to say.
Yeah, something like it's okay.
Yep, just keep letting it communicate if there's anything beyond that. That might be enough, but just see what else it's going to say. Because it's not worried. It's not nervous. It's balanced.
Yeah, it's like you are good enough.
Yep.
You can do it.
Yep. Just ask it, is there anything else that part wants to say, that balance part, that inner guide, as it were?
Yeah, also, like, you can let go.
Yeah. You don't need to carry that expectation anymore.
Yeah. All that tension.
Yeah. And just ask it this question. If the worst case scenario happened where you didn't meet your expectations and you didn't match those family kind of standards, what's it going to say to that?
Not a lot would happen. Because the expectations, I don't think, are actually there from them.
Yeah.
Just in my mind.
Yeah. So your heart is ultimately reaffirming, this inner guy is reaffirming to you that these expectations aren't actually there. And that you can let them go.
Exactly, yes.
Just go back to the part that felt nervous about all of that and just see if it's got anything else it wants to say. Anything else coming through with that?
No, but I almost felt like my heart rate has kind of dropped a little bit just by going back to it.
Yeah.
Which is interesting.
As in, when you went back to it, the heart rate dropped?
Yeah.
Like to normal or below?
I don't know. No, I think to normal. I just almost felt like it was relaxation came over.
Yeah. Ask if that anxious part has anything else it needs to say, or if it's got what it needed.
Yeah, I get the impression it's got what it's needed.
What's happening with the hands now that that's taken over?
Yeah, it's definitely less. What was interesting?
Yeah.
I almost feel like it's more symmetrical. Like it's more on the left than the right, which is interesting because it happens more when it's my left hand.
Yeah.
But it feels like it's overall less. And
just, you said that it becomes more obvious that there's a bit still on one side compared to the other, yeah?
Yes.
So the bit that's still more, there's something still in there. So just ask it, what's the thing that's left? And don't analyze an answer, just let it come up. It will come up. What's it still holding on to?
I don't know if this is it, but just kind of taking me back to early on in practice when I was having a bit of a bad time in practice, and I was finding that, and it seemed like there was a lot of patients under my care that were getting worse.
There's a want to not go back there.
Yeah, maybe.
What is it ultimately that represents to you? Because it sounds like it's something slightly different to the family expectations.
Yeah.
So what is it? So is it that you can't help people, or is it that you're making them worse? Which is it, the main one?
Yeah, making worse.
Yeah. So that sense that you carried back in that moment, you're still carrying that charge now. And when you're adjusting patients, there is that threat that's increased in that moment that your system's saying, well, don't do that because we don't want to go back to, making people feel worse again and how we felt around that. So that feeling of where you felt like making people worse, is it in that hand?
Well, it's intensified more on the left than the right.
Yeah. So what I want you to do is just feel that feeling for a second and describe the emotion that comes with it.
Mm.
We have to feel to heal. So that's why we're doing that bit first.
Mm.
And what emotion's in there? What emotion does that feel like?
I think the closest I can put it down to is nervousness.
Yeah. It's two-pronged, the nervousness. Done the first prong. This is the second prong. So now just ask that nervous part to communicate what it's struggling with.
Could be, feels like it might be identity.
Mm-hmm.
With chiropractic being like something that has been in my life for so long, almost like it's been taken away.
Yeah. A loss of identity. Is that a feeling you've had before? Is that something that's happened to you before?
As a teenager.
Yes, it did happen before.
Yeah, I got bullied as a teenager.
Okay.
And when I look back, I can see that I didn't know who I was.
You lost yourself. You lost your sense of self.
Yes.
And just for the listeners, everyone is born ultimately with a sense of self. Kids know themselves. They know what they want. They know what they don't want. They just can't articulate it. We all have that sense of self. And then eventually, boom, things happen that disconnect us from it. Yours was you got bullied. And you lost your sense of identity there. You lost your sense of self. And you're worried now as an adult with a maintained sense of self now that you could lose it again if you made people worse, because that would take away you being a chiropractor in one form, which is kind of what some of your identity is around. Is that fair?
Yes, I think so.
Yeah. Just see if there's anything else.
That's difficult.
Yeah.
Something like not being
Yep.
not being enough, or not giving the value that I strive to give.
Yep. Which is it? They're obviously linked, but which is the one that hits?
I think giving the value.
Okay. So do you resent the fact that you didn't give your value back when you were a teen because it was taken away from you, your ability to do it?
Oh, I don't know.
Is there something linked to that within you being able to give your value? Is it being taken away from you? Your value was taken away from you, or was it undermined?
Yeah, I definitely feel it's something. It is definitely linked with family expectation.
Yep.
And I put on myself.
Yep.
And being good at what I do.
Yep.
And again, that expectation I put on myself.
Yep.
And the worry of not achieving that, or particularly the worry of going the opposite direction.
Yes. Ask it why it's worried about that.
Yeah, I struggle to go any deeper than that.
So let me help you. There is something that not meeting your own expectation and having it being lower that is a threat to you. What's the threat?
Perhaps peers, colleagues.
Yep. Risk of being bullied?
No. Maybe risk of not being valued.
Not being valued.
For what I do.
Okay.
Yes.
Yeah. And for who you are, or just what you do?
For what I do.
For what you do. So that feeling of not being valued for what you do, is it in your eyes, or it sounds like it's your colleagues' eyes and people yeah? Not just the family, this part.
Yes.
This prong.
Yes.
Yeah. Is it anyone specifically, just so we're clear?
Yeah. I think some friends, yeah.
Great. You got them in mind?
Yes.
Great. Let yourself feel the fear of not meeting those expectations in their eyes.
I don't really see judgment. I more see compassion, actually.
Before I asked that question, what were you worried about? Were you worried about it being judgment?
Yes, I think in my head,
But instantly compassion came when you thought about it.
when I looked at their faces, I didn't see judgment at all.
Okay. Now you realize that, what happens to the nervousness and the anxiety around it?
It does ease. Yeah.
Okay. So what I want you to do is go back to that heart, breathe in and out of that region, and ask it for some guidance on this area and see what it's going to say. Now that it knows, ultimately, you'd have compassion from these guys.
Yeah, I think just that just knowing it's not true.
Yeah. That deep down, when you get down to the core of it, you know that those guys ultimately would show compassion.
Yes, exactly.
And it's annoying. It's not quite, you actually deep down know it.
Yes.
Just let that sense of knowing just go through you. And let it move down into the hands. Not just the hands, but let it go to the hands as well. Let me know you've done that.
Yeah.
Ask that inner guide, that balanced, self. Is there anything else it wants you to know right now to help you move forward from that challenge that you've just gone through? Or has it got what it needs?
I feel like it has.
Great. What's happening with the hands?
They feel more normal.
Okay.
Yeah, there's just no asymmetry either.
Great.
Yeah.
And relax. Well done. So you can see instantly how there was an individual in the world, you, finding a performance issue, didn't know what it was, but all the intelligence is in there. With the right questioning, you can connect with it. You did. You used your intelligence. You realized, actually, there's a lot of nervousness in these hands. And actually, it links to the expectations, that I put on myself based on family and the history you have there with successful chiropractors in your family. You worked on that bit, but there's still a little bit left. There was that inner wisdom saying, no, there's still something there. We've not fully dealt with this. Dealt with it a bit, but there's another prong. And then that related to the threat of judgment from people you really care about.
Yeah.
As soon as you actually connect with that inner guide, the mind and body start to change. I.e., that soul, the mind and body start to change, because all you're doing there is you're connecting with the problem. It's kind of like this. The way I simplify this, right, is that we all have voices of concern within, right? We can either hear them or we can feel them, and sometimes both. Those voices of concern are feedback letting us know we need a bit of guidance here. So it's almost like a child within. These parts are like children, not to undermine them, but we could look at them that way. Our inner guide, that soul, if you like, that self, that is the parent within. That's the guide within. And we've all got one. And it's always there. And all healing is just about bringing the two together. It's exactly the same thing. It's a metaphor for exactly what we're doing, right? The voice of concern is presenting, a guide is coming to the table, and it's letting it integrate. And when you do that, that's what allows things to move on, to be let go. And so your performance now, when you go in to adjust, will feel different. And you might still get the odd, what if this keeps going? Things can happen where you can still get remnants, but you should notice that there's a shift, because there has literally been a shift. And one thing to help with the shift is just in that moment, breathe in through that heart center. I know that sounds a bit wacky, but really what you're doing is you're grounding yourself. We know through a lot of science now that the heart communicates up to the brain more than the brain communicates down to it. It's the first organ that beats. It's where our natural intelligence, if you like, begins, in a sense. And so all you're doing by breathing in that center is you're just balancing yourself, because what fear will do is it'll push you up into the head. And then that, if you run there, then you lose that inner guide. So all you have to do is in that moment, I think you'll notice a difference regardless, but in that moment, just put your awareness there and do your thing.
Yeah, phenomenal. I mean, what was quite impressive about that, and annoying at the same time, which is how you kept digging. I was just thinking, no, I think that's it. And you're like, go more. And okay, something does come.
Yeah.
And that just kind of correlates so well with what we were talking about. You just got to keep digging, and if you don't, then yeah, you just get to the surface of it, don't you?
You can tell as well, like I've done this enough times now, that you can tell when someone's there and you can tell when they're not. It's like there's a physical thing, it's an energy thing that you can just tell when someone's not quite there. And you made a shift, but I could just see that there was just still something sitting underneath.
You mean I couldn't hide it?
Yeah, exactly. But what was great is that you did what anybody that works with anybody, and you'll know this from having patients yourself, you need that individual to just be honest and just be a little bit vulnerable and bring it to the table. Because when you open up in that way, that's when you can, shift what's there.
Ben, thank you so much. You have been such an influence to me from the very start of my chiropractic journey, and that influence is been hugely impactful. And I'm pretty sure I wouldn't have taken the same journey that I would have taken if it wasn't for you. And I know you do so much with so many people, help so many people, and yeah, thank you so much also for coming down to come onto this podcast. And yeah, I really hope everyone took as much from it as I did. My very last final question is, do you think we're going to win the England match tonight?
Well, when this comes out, everyone will know.
I know.
But bear in mind,
What's your predictions?
A Scotsman down in the south of England today. And but no, I believe it or not, I will be cheering on the English at 100%. Like my granny's English, my wife's English, half of my family's English, and I've got over the kind of petty, the wee man syndrome, if you like, when it comes to Scotland and England. And no, I'm very much on their side tonight, but we'll see what happens.
Lovely. That is the correct answer.
Yeah, come on, England.
Yeah. Oh, thanks, Ben.
Cheers.